So sharing visual outcomes following implantation of an extended depth of focus IOL in patients with macular degeneration. This study was part funded by research grant support from Alcon Laboratories, USA. So the purpose was to evaluate the visual outcomes following implantation of a non-diffractive extended vision IOL in patients with pre-existing early dry age-related macular degeneration. It was a prospective interventional case series performed at Raghudeep Eye Hospital at Ahmedabad and Jaipur, and all adults above 40 years of age having non-traumatic cataracts were included. All eyes underwent phacoemulsification with in-the-bag implantation of a non-diffractive wavefront shaping extended vision IOL. Patients included were with uncomplicated age-related cataracts ranging from grade 1 to 4 on the LOCS grading system, and pre-existing stable age-related early dry macular degeneration, which was defined on the AREDS2 criteria, that is multiple small drusen's less than 63 microns or few intermediate drusen's between 63 to 125 microns, or pigmentary changes at the macula. So the diagnosis was done both on fundus photography as well as on posterior segment OCT on the macular scan. All cases with either wet macular degeneration or not fitting into the AREDS2 criteria of early ARMD or any other ocular comorbidities were excluded from the study. The primary outcome measure was monoocular corrected distance visual acuity at 4 meters on the ETDRS chart at 3 months postoperatively, and the secondary outcome measures were monoocular unaided distance visual acuity at 4 meters on the ETDRS chart, monoocular uncorrected and distance corrected intermediate visual acuity at 66 centimeters, and monoocular uncorrected and distance corrected near visual acuity at 40 centimeters. All of these were evaluated at 3 months postoperatively. The age range was 68.5 plus or minus 8 years. There were equal number of male and female patients and almost an equal number of right and left eye. The average axial length was 23.37 plus or minus 1.1, which means no gross myopic or grossly hyperopic eyes were included. And the average nuclear sclerosis was grade 2. 63% of eyes also underwent the toric version of the extended depth of focus IOLs, as all of them were evaluated using the Barrett's Universal 2 toric calculator. Coming to the results, the distance visual acuity, unaided distance visual acuity was 0.12 plus or minus 0.7 at 3 months postoperatively, whereas the corrected was 0.1 plus or minus 0.1 at 3 months. So 0.12 is roughly equivalent to about 6969 parts on Snell's visual acuity. So the mean corrected distance visual acuity equivalent Snellen's was about 6 to 7.5. The unaided intermediate visual acuity was 0.25 and the unaided near visual acuity was 0.23, and both of them corrected improved to 0.1. The average near add needed at 66 centimeters was 0.86 plus or minus 0.18 diopters, and the near add needed for 40 centimeters was 1.3 plus or minus 0.18. The most important part of the study, the contrast sensitivity in mesopic conditions with and without glare at all different cycle speeds, did not show any significant worsening with glare or without glare and were comparable. There are early reports of literature showing good outcomes of these extended depth of focus IOLs in subtle macular pathologies. The strength of our study being that we strictly followed the AREDS criteria based on fundus as well as posterior segment OCT evaluation. And therefore, we conclude that this IOL had a very good distance visual acuity along with good intermediate and near visual acuity, but most importantly, without compromising contrast sensitivity. Thank you so much.
Thank you, Dr. Shail.